I'm Matthew Budoff. I'm a preventive cardiologist and a professor of medicine at the UCLA School of Medicine. Yeah, so we want to do a trial with low-dose colchicine in stable coronary patients. I think there's still a little bit of confusion about the potential benefits of colchicine therapy as an add-on to things like statins and other treatments. So we wanted to do a prospective randomized trial looking at plaque progression to see if it affected atherosclerosis. Yeah, so we took patients with stable coronary disease. We randomized them to either low-dose colchicine, 0.5 milligrams once a day, or placebo, and did a serial CT angiography. So we did a CT angiogram of the coronary arteries at baseline. We followed them for a year on treatment, and then did a follow-up study at the end of 12 months to look at changes in plaque over the course of a year. Yeah, so we found that low-dose colchicine reduced plaque atheroma volume, or PAV percent, by over 1%, which is considered a very significant amount. In the intravascular ultrasound literature, a 1% change in PAV was equivalent to a 25% event reduction. So our study strongly supports the LODOCO-2 trial and the COLCAT studies that showed 23 to 31% event reduction with the use of colchicine. Well, we saw two big changes, one in percent atheroma volume and one in dense calcification. So we actually saw a lower prevalence of calcification, which might go along with the anti-inflammatory effects. C-reactive protein did go down significantly. But I think it definitely reinforces the mechanistic benefits of anti-inflammatories by showing that we can reduce inflammation and reduce atherosclerosis simultaneously. Yeah, so I would say that for patients who have underlying atherosclerosis, who have elevated C-reactive protein, or you're worried about them from an inflammatory perspective, low-dose colchicine was both safe and effective at helping reduce plaque atheroma. Yeah, so this was a small funded study from the Stanley Ekstrom Foundation. It was limited to 84 patients enrolled. So we need to really do larger and longer studies, but I do think that this does add to the existing literature in stable CAD, the benefits of colchicine therapy.